I felt this weird, like, popping sensation in my back. I was a pretty active person. I did yoga multiple times a week. I went hiking. I had been learning how to ski. They just figured I had just done something to mess up my back. I was actually in the car going away for the weekend because it was actually my birthday. We had planned a long weekend with some friends, so I was actually like on my way to go have fun for the weekend. I get a call from my primary care's office, and the doctor was kind of like, this is really serious. They found a tumor. My name is Ashley. I have stage four non small cell lung cancer. I was diagnosed in August of 2023. Going upstairs was difficult. And I was in really, really good shape at the time. So that was just weird to me. And they were like, oh, yeah, like no pneumonia. We took an x ray, it's clear. It's probably just bronchitis. Take some antibiotics. Here's an inhaler. You'll be fine. And then it got a little bit better. And then about, I want to say April, the same thing happened where I just got really sick for like about a month, um, really out of breath. Um, and just, it was just like very out of the normal for me. Even if I got a cold, usually I would be over it very quickly. And then around the same time, I was sitting at work and I just readjusted myself and I felt this weird, like, popping sensation in my back. And then over the next few days, it just felt like I had like thrown my back out or like that there was a muscle issue. So eventually I went to the doctor and got it checked out. And because I was a pretty active person, I did yoga multiple times a week. I went hiking. I had been learning how to ski. They just figured I had just done something to mess up my back, and they said, "Go to PT and get back to us if anything changes." And while I was doing physical therapy, it just progressively got worse, to the point where we weren't even able to actually like get into like doing stretches or exercises because every appointment was just about sort of managing pain. And it was my physical therapist that finally reached out to my primary care doctor saying, we need to do some more imaging because this is not normal. I've never seen someone my age in my condition without a real good explanation as to why I was experiencing the amount of pain I was in. And so that was when that kind of prompted my primary care to say, all right, well, let's at least get an MRI and we'll set you up with a neurosurgeon because they deal with backs and we'll take it from there. And that's when it started to snowball into this was not necessarily a neurosurgery issue, but a oncology issue. It was pretty quick right after my initial MRI that the radiologist reached out to my doctor's office saying, this is serious. This isn't just an injury. This is something that needs to be biopsied and dealt with quickly. Everybody was confused at that point. Nobody really seemed to have a great explanation as to why, without a lot of other symptoms, um, I had already had signs of basically bone metastases. They looked at breast cancer, so I had mammograms done. They were looking at different blood disorders, like leukemia, lymphoma, like and things like that. Like they were doing tests for all of that. They weren't looking for lung cancer. I didn't have a CT scan till after they had already knew it was lung cancer. And then in my initial diagnosis, um, I remember being asked multiple times by my oncologist, so, like, "You weren't a like, you didn't smoke, you weren't a smoker," and it was, like, pretty frustrating, and I remember me and my husband getting like, "No, I'm not a smoker, I don't know how many times I can tell you." It was almost like they almost didn't believe me at first. My parents were smokers, but they never, like, smoked in the house or in the car with us, so it's not like I was exposed to all this secondhand smoke either. I had pretty much the same exposures most people do, which is occasionally the people in your life are smokers and, like, but not anything significant day in and day out. Within probably an hour, and I was actually in the car going away for the weekend because it was actually my birthday. So, we had planned a long weekend, m with some friends, so I was actually, like, on my way to go have fun for the weekend. I get a call from my primary care's office, and the doctor was kind of like, "This is really serious. They found a tumor." Generally, he's like, "In my experience, when, we see this kind of imaging, it's cancer somewhere else." And he said, "So we need to kind of work to to find that." And he was great because he reached out to the oncology practice associated with my primary's office and basically said, "I want her to have an appointment next week." He ordered a bunch of, like, blood tests. In the meantime, he told me, "If you can make sure you're up to date on, like, preventative vaccines and things like that, you're gonna want to." He's like, "Regardless of where this goes," he's like, "I want you to be, like, protected against things." Like, he really put things in motion very quickly. I was very thankful for that. Once we met with my first oncologist, she had ordered a biopsy of the tumor that they had found in my back, and then other things like bone scans, blood tests, things like that. The biopsy of my bones was what revealed that it was lung cancer. The bone biopsy was actually really probably the hardest part of the whole process. It's probably one of the worst medical procedures I've had done in this whole process. So sometimes thinking back to it actually, like, gets me all flustered again because it was a really, sort of traumatic traumatic day. I had no idea how difficult it was going to be, and up until this point, I had been, like, really healthy, so it was kind of like the first time I'd ever really been in the hospital for, like, a procedure, and at that point, like, we really didn't know what to expect. I ended up with, I think, a total of 7 vertebrae that have tumors in them. I have a fractured rib that just won't heal because of all of this. The crazy part is I only had one tumor in my right lung and a couple of nodules in my left lung. It was actually really, really small, um, for the fact that it had already, like, spread to other parts of my body. Um, I was lucky that it was just bones and lungs, and 2 years later, it's still just bones and lungs, which is great. I've never had issues with, my liver or my brain, which are 2 common places for lung cancer to spread. So I actually kinda laugh because I feel like, media, like movies and TV shows, has put this perception in our head that, like, you get to a moment where, they're like, "Okay, and you have cancer," and it's like the first time you've, like, ever, heard it before. In my case, it was really more like drips and drabs. Um, so after my first MRI, we were pretty sure that I had cancer. It was more of like, "What kind of cancer?" Um, After the bone biopsy, that was when I got, like, I knew it was lung cancer because the bone biopsy had shown basically they can tell where the primary tumor is. And I actually got that like through my chart. And I remember I was out, I was on vacation with my husband and several of our friends, and I got like the notification on my phone, and we were out at dinner, and that's kind of when I pulled up the report, saw what the report said, kind of took a deep breath, put my phone away, and then just kind of tried to continue on with dinner and having fun. And later that week, we went in for an appointment, and that's sort of when they kind of started to explain what it all meant. And my oncologist, who's now my oncologist now, really kind of like laid it out for me, um, that my cancer wasn't curable, that it was very serious, that although it would probably not be my case because I was young and I was otherwise healthy, most people, it's, a 6 to 12 month survival type diagnosis. He was confident that that wasn't going to be my situation, but, he's also very much like a very data driven provider. So for him, he's like, I can't make any guarantees. He's like, this is just what we see in the data. My father had gotten care at Dana-Farber and they were amazing. And my sister-in-law had breast cancer and she had gotten care at Dana-Farber. So we had already like known several people who had gone there, and we always knew that at minimum we wanted a second opinion there. Um, we were willing to give my local hospital a chance. And we also didn't want to delay initial treatments or anything like that. So I did start chemo locally. But then once we kind of realized that they were kind of downplaying my diagnosis, we decided to make the switch. Um, it was I really, for anyone who is in a reasonable area of Dana-Farber, I always say, um, call them because they know how difficult between insurance and scheduling and appointments, they know how challenging that can all be, and they really do work hard to, like, streamline it. All I really had to do was make a phone call, and they took down sort of my basic information and who my doctor was, and next thing I know, they're calling me, and they're like, "You have an appointment on this day," and I was like, "Do I have to do anything else? Do I have to send you things?" They're like, "No, no, no, we got it." They did a blood biopsy pretty much, like, right away once they knew it was lung cancer. And then they also, once they took a biopsy of my actual tumor, they did additional testing because I guess sometimes there's some tests that on the physical tumor, it's a little bit more sensitive than the blood biopsy. Um, I saw that it was HER2, but at my time of diagnosis, there were no HER2 approved treatments for lung cancer. So it was kind of like, this will be good in the future if either for clinical trials or if things do get approved. About 4 months before I saw progression on my first line of treatment, they did actually the FDA approved a HER2, targeted therapy. So I've been on that now for almost a year. It'll be a year in August. and I still have no progression. We're hoping that more HER2 treatments get approved before I see progression, because unfortunately, it's feels weird to say unfortunately, but unfortunately because of where my tumors are, and they're hard. It's hard to measure tumor growth in bones. So I'm just not a great candidate for clinical trials, because with clinical trials, you need to um, be able to really measure the tumor growth, and in bones, it's not the same as if it's in your liver or your brain or things like that. So while I'm thankful I don't have tumors there, it also is nerve wracking because I'm worried about progression without other HER2 targeted treatments available. It's crazy how fast, like, the cancer space can change as new drugs come online, because I think my current treatment, which is a targeted therapy for HER2, I think is now being considered part of first line treatment, where for me, it's been my second line. My first line was a more traditional platinum-based chemotherapy, and I did 4 rounds of just, like, a heavy chemo, before my body was starting to show signs of not being able to handle it more. I was having a lot of, like, liver enzyme issues and things like that. We dropped one of the drugs I was on and then just stayed on basically a maintenance chemo dose, and that was able to keep me progression free. Um, for about a year, I was that was my whole treatment regimen. Um, we made the switch to the targeted therapy when I had had 2 PET scans in a row, 6 weeks apart, showing a lot more activity, not just in the bone metastases, but also my lungs were starting to there was multiple nodules popping up in my lungs. And that's when we made the decision. My oncologist has been really good about being like, if we're just seeing a teeny tiny bit, he's like, we can probably hold off switching. He's like, he always uses the expression, we only have so many tools in the toolbox. So we want to use basically all the tools till they're not useful at all anymore. We have talked about radiation on individual spots, particularly like the bone metastases. But again, we're holding off on that because you can only do so much radiation. Um, and then through all of this, I did find out I have a rare genetic disorder that makes me predisposed to cancer. Um, so radiation is very highly discouraged for individuals with this genetic disorder. It's kind of like a last resort option, because I'm at just such an elevated risk for developing additional cancers. We don't want to, you know, set that off. I think I'm on my 18th, going into my 18th round in a couple weeks of my targeted therapy. I did have to take a break for a while because I was experiencing some lung inflammation, which is like a known side effect of this particular drug. And we were trying to suss out whether it was due to the drug or just due to um, being sick and having lung cancer. So my lungs are just more apt to experience inflammation. Eventually, we determined that it was more likely than not just being sick and my body trying to heal, and not the drug, and luckily, that is proven to be true, because if it was the drug, then I wouldn't be able to continue on the drug because the lung inflammation is such a serious issue, um, that the the guidance is that once you experience this kind of inflammation, you have to discontinue the treatment. The targeted therapy, it was one of those things, like, I think there's a perception that because it's targeted, it's somehow going to be easier, and it's actually been a really challenging, drug to be on. Luckily, I have really awesome nurses that work really hard to make sure I'm in the best shape possible leaving there, and then, I now work with, a palliative care team that has been really good about, adjusting medications and, finding sort of different routines for me to help make, that post-treatment week a little bit easier. Overall, I'm grateful that this drug had been approved when it was, because had it not been, I would have had to go to a harsher, older chemo that is less effective, and, I might have been in the position where I might have had to stop working or things like that because, as difficult as this drug is, I know it's not as difficult as some of those older. I'm definitely, open to clinical trials. I think, once it was kind of explained to me that, it's not that you don't get any treatment in a clinical trial, it's basically you get, either the standard of care or you get the drug, and we're looking to see, is this drug better or the same or worse than the standard of care? I was kind of like, "Oh, okay, like, that makes a lot of sense." I was getting to the point where even things like going to the bathroom were difficult because I was just in that much pain. So the idea of delaying treatment in order to freeze eggs or embryos was, I quickly was just like, "No, this is crazy." And I was like, "If we get on the other side of this, like, there's always, like, adoption and foster care and there's other options out there." When I realized, though, that this is gonna be sort of a lifelong, um, treatment, um, that that was hard because, um, even though we had gone back and forth about having kids and hadn't really made a decision yet, um, it then felt like the decision was taken from us. It still does make me sad sometimes to know that I won't have that opportunity. It gets exhausting sometimes. I find that I'll go several months where I'm feeling good and life is good, life is great. And then usually it's around um, a week when treatment really like hit me really hard. I'll get pretty down, and you have those thoughts of like, how can I keep doing this? I think mental health is a huge part of um, treatment, and I'm lucky that through my treatment at Dana-Farber, I'm able to get mental health counseling. My mom passed away from cancer when I was a toddler, and when I talked to family about what she went through, the drugs were so harsh. So the fact that we're living in an age where you can have these really serious diagnoses and but still have a quality of life, still work, still participate in your hobbies and things like that. That to me is like amazing. And that's what keeps me going, is almost kind of like remembering all the people that we've lost in the past who weren't able to have the quality of life that I have, because the drugs have just gotten so much better and treatments have just continued to improve, and they continue to improve every single day. So even if I never get cured, I'm hopeful that, the next drug that comes on the market is going to be, that much more effective and that much more easily tolerated, and will give me that much better quality of life. While you're young and healthy, do the things that you want to do. If you want to go visit a country, figure out how to make it happen. If there's a restaurant you've always wanted to go to, save up the money and go to the restaurant. Don't wait for later in life, because you might be too incapacitated to actually do that. Through sort of the testing that we had done, and then my personal family history of cancer. Both my parents had cancer and have passed away from cancer. Like through that, I found out I have like a genetic condition called the Fertility syndrome, and through that, I've told people to that it's not normal for there to be multiple people in your family tree having cancer. And if that's the case, even if you are okay, I really encourage people to talk to their doctors to look into genetic testing, because it's not normal to get cancer young, and it's not normal to have multiple either aunts, uncles, grandparents, parents. If you're going through your family tree and there's several people who have had cancer, it's definitely worth the conversation, because even compared to 10 years ago, what they know about cancer genetics is um, definitely grown. And if I had known that I had had this genetic condition years ago, I would have been getting screenings that would have been able to catch my cancer when they would have been able to do surgery and things like that. So definitely something for people to look into.